UPMC is a leader in pancreatic diseases, including pancreatic cancer, because we have a very large patient population that we are 100% dedicated to, and we have recruited physicians who are also scientists who work together to provide the most advanced cutting-edge technology available and to invent new approaches and new technologies that will help these patients that currently are in deep need.
We specialize in several unique aspects of the care of pancreatic cancer. First, we have a multidisciplinary approach with physicians from oncology, surgery, radiation oncology who meet weekly to develop comprehensive personalized care plans for the patients. We're leaders in clinical translational trials, and we're some of the world's leaders in minimally invasive approach to pancreatic surgery.
We take a personalized approach to our individualized treatment of our patients using innovative techniques, precision medicine, and personalized care.
For the past decade, we've pioneered the utility of molecular diagnostics in not only the classification but prognostication of pancreatic cysts. More recently, we've developed an 8-gene panel of molecular alterations that can be identified in not only classifying pancreatic cysts, but predicting whether they'll be malignant or have the potential to be malignant.
A number of efforts have focused on the genetics of pancreatic disease, both in germline mutations that are inherited from the parents and acquired mutations as inflammation begins to change into cancer. But there are actually 11 genes that we have identified, including the gene that causes hereditary pancreatitis, which is the highest known risk factor of any common disease for the development of pancreatic cancer. These are important for classifying patients correctly and giving them the needed medication in what we call precision medicine.
We have a long history of using molecular analysis in pancreatic cyst fluid aspirates dating back over 10 years, and certainly techniques have evolved over the past decade, but we believe that we provide better diagnostics now and can actually prognosticate.
Through a joint development of a pathway through the Department of Medicine and Gastroenterology, as well as surgery and pathology, we have developed a pathway to assess pancreatic cysts of larger than 1.5 centimeters, and then to do ancillary studies that include not only cytopathology in the Department of Pathology, but also molecular analysis.
My current research is using an animal model of pancreatic cancer, in which what we've done is we've recapitulated the genetic changes that happen in human patients with pancreatic cancer. This allows us to study all aspects of disease, from the precancerous stages to the stages at which cancer is developing to the end stage of the disease. And this allows us to understand what are the different components and what parts of the organism are contributing to the development of cancer. My work in particular has focused on the role that the nervous system plays in the development of pancreatic cancer. And from my interactions with the clinician scientists at UPMC, I've been able to identify the important features of the disease that my model replicates. And what we've been able to do most recently is show that if you ablate the nervous system, if you interfere with the nervous system, you can delay or actually prevent the development of pancreatic cancer. And this is a novel finding that has not been described before, and gives us new ideas of what the mechanisms are that actually underlie the progression of pancreatic cancer.
The minimally invasive approach to pancreatic resections has undergone a great evolution since we first pioneered this approach in 2008. Our early studies demonstrated that it was as safe as the traditional open approach, but more recent data is showing that it's living up to the promise of small incision surgery. Our patients are recovering quicker and they're getting onto their chemotherapy quicker.
Precision medicine includes genetics, and what it does is takes a broad array of genetic information and put it into the context in order for a proper interpretation. So we have not only done the research, but we are implementing this in our practice. Our pancreatologists have the ability to order the genetic test and do complete analysis on patients, and then meet with a scientist in order to come up with the best solution for that patient. In addition, our pathologists are able to take the genetic findings that have been reported in research studies and use it in our clinical patients in an effort to identify the best treatment for those patients. The work that has been done has led to a number of international lifetime achievement awards for our physicians, recognizing the contribution that they have made to this area of pancreatic disease.